Sweetser is a nonprofit community mental health provider offering quality treatment, support, and hope for people of all ages. Services include mental and behavioral health, intellectual and developmental disabilities, recovery, and education. Our staff, volunteers, and donors help create promising futures for those we serve. As the largest mobile crisis provider in the state covering more than half of Maine's 16 counties, Sweetser wants people to know that support is available. Learn more at sweetser.org.
Okay, thank you all for tuning in. Today we are very lucky to have Justin Chenette in the house. And Justin Chenette is here to talk to us about the mission of Sweetser. What exactly is Sweetser, and what is the mission of Sweetser?
Well, thank you for having me, Patrick. So Sweetser has been around since the 1800s, if you can believe it. Not many organizations can say they've been around for nearly 200 years, but we've been serving children and families for just about that long. We actually started out as children's orphanages and have now morphed into really meeting the comprehensive needs of Maine people when it comes to mental health challenges and substance use services. And so Sweetser really envisions a world where mental health stigma can be eliminated and access to treatment and recovery is possible for every Maine family and Maine individual.
Are you strictly in York County? Who do you reach?
So we're all over the place. We're in every corner of our state. So we served over 12,000 adults and children just last year alone. So a very sizable population of individuals. We had over 30,000 calls to our peer support line, the line that really is there for folks who really just need someone to talk to, who might feel isolated, who might need to just speak to somebody who's had lived experience with either mental health or substance use. And so that speaks to the need that's across the state. I mean, 30,000 phone calls. So we see consistently that the need is great, that people have various mental health challenges and are having issues with trying to reach out for support. Stigma still exists in terms of seeking out mental health treatment. Luckily, it's been reducing, but we reach anyone, children. We work with families in schools, for instance. We have a special K through 12 special purpose school in Saco on hundreds of acres of land with various other programs. We're the largest provider of mobile crisis services across the state, meaning we come to you. And as you might know, a crisis can happen in inopportune times and environments. So, you might be under a bridge. You might be at a primary care office. You might be at work. You might be in school. A crisis can happen in any time. And so to have literally a team of individuals can come out and meet you and co-respond with law enforcement, it's critically important. So there's a lot of different resources out there. We're one of many providers, but we're really the leading behavioral health organization within the state of Maine.
You have a wide and varied background yourself. You were a legislator for 4 terms, and your resume is extremely wide-ranging and impressive. How did you end up with Sweetser?
Well, I always believe that service takes so many different forms. And for me, serving 8 years in the legislature was a big honor. It was the honor of my life. And I really wanted to seek out opportunities to continue that service, but just packaged a little bit differently. And I know that mental health is not only meaningful for me personally, but so important across our state and across our country, quite frankly. And so nonprofit work has always been very special to me. And so the ability to, I live in Saco, and to be able to work in Saco and then have an impact literally across the state was very enticing to me. So I've been there for 3 years, and I'm their Senior Director of Public Relations and Advancement.
Now, we have probably, from what I understand, the oldest population in the nation, and you mentioned earlier isolation,
yes,
particularly in rural areas like this. Do you serve sizable elderly clientele?
Yeah, a big range of individuals, various ages and backgrounds. I would say for seniors, I think a lot of times, as you mentioned, particularly in rural areas, they don't have the necessary community supports that you might have in other places. There might not be organized activities, or it may not seem like there's organized things for them to, or a positive outlet for them to participate in. And that's why I think, having somebody to talk to is so critically important. So trying to find, where are those those pockets of individuals. Like there might be a book club in your community and you might not even know it. So I think a couple recommendations. One, if you're feeling isolated, whether you're a senior or otherwise, you can use the internet to find different groups that might be it might exist in your area. I know, for instance, Hollis has in Buxton have sort of Facebook groups of individuals that live in the community. Even posting out, "Hey, I'm interested in this. Is anybody else interested in that?" Using that as a cultivation tool to try to foster in-person relationships can be really important. Or our peer support line, again, is staffed by individuals who have had lived experience with mental health, but we find that there's a lot of frequent callers that are like just checking in every week, like, "Hey, I'm struggling with my emotions with this. I'm struggling with this particular challenge." And again, just being able to be there to listen is half the battle. And so we actually do find folks call quite frequently on a regular basis from rural areas that are seniors, other folks that feel isolated and alone. And so I think, again, it's trying to find those opportunities to foster connection to something much larger than yourself individually. I also would recommend, if there's an opportunity to volunteer, you can absolutely meet people that way that can absolutely change your life. I find volunteering uplifts your spirit. It makes you feel good. You're able to give back to, in some cases, your own community, and in doing so, you can meet people that can be lifelong friends. So that could be volunteering at your church, that could be volunteering at a school, that could be volunteering at a local food pantry. I think that puts yourself out there a little bit. And again, that might make you feel more connected to your community, feel more connected to other human beings. That sense of connection is what really is important in terms of fostering good mental health.
Conversely, we have the younger population.
Yes.
And the crisis that lies there.
Yeah.
Talk about that and the role you believe social media sometimes plays in that regard.
Absolutely. We are in the midst of a youth mental health crisis. We see study after study, data point after data point, all leads to the same conclusion that our young people are struggling right now. They're struggling in school and they're struggling online. Social media can absolutely be both a tool for connection and a tool for disconnection. And I think that that's sort of a hard dynamic to wrap our heads around sometimes. But for young people, cyberbullying is real. And so the comparison to other people is real. When you're seeing different images on social media of different body styles and just so much coming at folks in terms of what's happening in the world around them. Young people are grappling with very big challenges that maybe decades ago you didn't really have to worry about as a kid. You're thinking about global warming and the existential threat to our way of life and how that you're trying to hold on to that while trying to live your everyday life and go to school and be educated. You're having to go through active shooter drills because you're worried about a shooter on campus because of school shootings that are across the country. Those are really weighty and big topics that, again, when you're trying to just grow up, you're trying to make friends, you're trying to, be a part of sports teams, you're trying to do well in your school, in your classroom. That can be a big challenge. And so we definitely see the weight of various mental health challenges. COVID absolutely also played a role with some of that. So coming out of COVID, we did see, an increase in need for various services. And I think the sad part is, a lot of providers are pulling out of schools. For Sweetser, we absolutely had to make cuts in terms of our ability to actually put clinicians on school campuses because the financial model is not efficient. It's not sustainable for us to do that. We actually lose money. We lost over $1.3 million on that program alone. But we believe in it. We believe that we need to be reaching kids and their families, working with the families to figure out how can we best support the youth. And sometimes a lot of the mental health challenges stem from the home. And so to involve families every step of the way, they obviously get a benefit, but they're making sure that the treatment is effective for their particular child in their particular circumstance. But we were in over 100 public schools. I think we're over 40 now. Just in the last year, we've had to make those cuts. And we're not alone. A lot of other mental health organizations have had to do the same thing at a time when we see the mental health challenges have never been greater. So it's really disappointing to see that. We are obviously working with our legislative colleagues and champions at the state level to see if there's some long-term funding solutions. But there's a lot of budgetary issues right now, both at the state and federal level, and a lot of uncertainty. And so while we remain hopeful that there's going to be a solution, we're really concerned that the future of providing school-based therapy is at risk.
As far as accessing services, you have walk-in clinics. Could you talk about where those are?
Absolutely. So we have 3 what we call Hope and Healing Centers, but they're mental health and substance use clinics in Sanford, Brunswick, and Lewiston, and it serves the residents in each of those counties. So for instance, for us, out of our Sanford clinic, we would serve anyone in York County, where you can come in off the street and get same-day access to care coordination and figure out what kind of treatment or what kind of program you need to be successful and healthy in your own recovery journey. That's really important because it's sort of like when you walk in to get physical health care, right? It's that same idea where we're reducing barriers to accessing critical treatment and services. So because of these Hope and Healing Centers, we're able to serve at least 750 plus people in those areas because of having those physical spaces. And because they're kind of centrally located, we're able to serve folks, our unhoused population, other folks that struggle with transportation and other needs. You can literally just walk in off the street and get the support. We don't turn anyone away from care. We actually provided over $1 million worth of treatment to folks who had an inability to cover the cost of that care. That again speaks to the need across the state and the fact that there are gaps in insurance. There's a lot of folks that are underinsured or uninsured. Maybe their mental health care is not covered by their insurance, or they simply lack the resources to pay for that care. We also find that a lot of reimbursement rates simply are from the state or federal government are not sustainable for a lot of programs. So we end up having to eat the cost differential. And so we have to rely on the generosity of communities and generous individuals and businesses to help make up that difference through fundraising. But, that's really a hard pill to swallow sometimes. But our clinics are so important. Basically, I would consider it like your gateway into accessing the behavioral health system. So you don't have to know all the acronyms. You don't have to know what you need. If you just know you need help, with your mental health, come into the clinic and get the support that you need. We have a whole access team that can really walk you through, based on your needs, based on your assessment, what is best for you and where there are openings for services.
This morning, I was talking to my sister about our grandmother, who I never met. Back in the 40s, she was admitted to AMHI. At that time, there was tremendous stigma on mental health, and to a degree, there still is. They were very broad in the way they diagnosed her with melancholy, which covers many different areas of mental health. But what are you seeing as far as awareness goes? Is that stigma lessening?
I think so. I think what we're seeing, especially with younger and younger generations, that the conversations become more public. Even conversations that we're having today, right here, with you, Patrick, is really helpful in reducing that stigma. The more we can talk personally about our own challenges with others in our lives, with our friends, our families, our neighbors, the more other people are willing to step up and share, and then subsequently get connected with critical resources and treatment. Even, as simple as naming our clinics as Hope and Healing Centers, there was a purpose behind that. No one wants to go to the mental health clinic or a quote-unquote mental health hospital, right? Again, that kind of speaks to your question, where it's like there's a stigma even attached to the name, right? And so the fact that you can walk into a Hope and Healing Center and get a whole broad range of services. It speaks to the fact that we're trying to be stigma busting. I think the more we can have these kind of conversations and kind of talk through, like normalize the conversation, that just like you're seeking out support for physical health challenges, mental health challenges need to be part and parcel to that. There needs to be equity and parity when we're talking physical health and mental health. And I think we're starting to see that. I think the ice is thawing on that front. And I feel so empowered to see, particularly Gen Z and younger, particularly having those very open conversations. They're demanding more, support from schools. We're seeing even young workers in the workplace demanding more from their employers to say, hey, mental health needs to be a component. We need to be thinking about work-life balance. We need to be thinking about how to be flexible when it comes to our own mental health challenges. That may have been unheard of in the past. And so the fact that we're starting to have those very public conversations, I think is a great thing for our society.
Well, I'll tell you one thing. Growing up in the 70s, I never had a conversation where a friend would say, gee, I'm struggling with anxiety. It just never happened.
Right, yes, absolutely. And now we can have that conversation, and it doesn't feel abnormal to be like, yeah, you know what, I am kind of struggling right now. And, how can we, identify those signs and find that support? And actually, one of the interesting things that we do is we provide free mental health training for a lot of civic groups, organizations, businesses, that it's like, hey, if you just need help identifying the signs of mental health challenges or suicidality in other individuals, whether it be your clients, patients, fellow coworkers even. We've done this with a number of businesses that are more customer service oriented, where, there's a lot of stress and strain in hospitality and tourism and just dealing with people, right? And so, looking after your fellow coworkers to be like, hey, I kind of noticed, you're a little off today, just not only recognizing those signs, but how to have those sometimes difficult conversations. Sometimes it's the barrier for folks to provide support to people in their lives is that uncertainty of how to begin that conversation, how to broach a particular topic where they may have not had the comfortability before. And so we provide these free trainings. It's through a grant, and it's been absolutely wonderful to see folks really take that on and be like, you know what, I can now provide greater connection and support to folks in my life. And the more folks I think that have that experience, I think the more we're really creating mental health ambassadors, in the community.
All of us, to one degree or another, have periods where we feel like we feel blue sometimes.
Absolutely.
Whatever the case might be for that. How do you differentiate between everyday low-grade depression and crisis level depression?
Absolutely. And I think it's hard for people to really figure out where they're at. That's why there's professionals. I think, the fact that if you recognize that you need help, no matter where you think you are on that spectrum, it's important to pick up the phone. It's important to reach out. And so there's a lot of different phone numbers. There's a lot of different ways to do it. I would say that if there's one number for people to remember, it's 988. And so this is an effort to really, again, reduce the barriers of accessing not just crisis services, but just help in general. Much like you and I are familiar with dialing 911 to reach emergency personnel and emergency services, the hope is to really have this as a national hotline. If folks are really struggling with their mental health, they're feeling an immense sense of hopelessness, and they don't know where to turn. 988, you can text or call. Which in and of itself is helpful because sometimes, picking up the phone can feel like a barrier. There are folks that have anxiety talking to folks on the phone. That's okay. We can acknowledge that. So text 988. There's also an online chat feature, which, again, a lot of folks are comfortable doing behind the safety of a keyboard. They're going to then be put in touch with professionals and local providers like Sweetser, where, again, we can then assess, where they're at in their journey at that given moment. Maybe it requires immediate intervention like a mobile crisis team, and maybe it's around connecting to longer term services like just general therapy. But regardless, that's a number that I just really hope that people start to think about and remember. And I think the more we can get the word out at 988, just use that as your mental health phone number, your crisis line, much like 911 is for emergencies, I think it's going to be life-saving.
You know, I'm not making light in any way of mental health issues. We all struggle with it to one degree or another, but I'm reminded as you say this of a joke Rodney Dangerfield once said where he said, I called suicide prevention and they put me on hold. Do you have
Yes.
do you have wait list issues with Sweetser?
That's a great question, Patrick. Absolutely. There are wait lists. I'll be honest with you. One report cited at least 10,000 Mainers across the state are on a wait list for services today. 10,000 people. I mean, that's just a staggering number. If there were 10,000 people waiting for hospital services or physical health, it would be on the front page of the paper and on the breaking news in the evening, right? But the reality is we're struggling to meet that need that is across the state. And I would say one of the big reasons is workforce. There's a lot of workforce challenges in Maine in general, but I think this is difficult work, and I see this with my colleagues. We have over 500 staff at Sweetser across the state, so we're a large employer. We have independent affiliates, which we call providers, in every corner of the state, essentially individuals, professionals that want to kind of basically open up their own shingle and provide various services, including therapy. And those affiliates take a lot of clients off of our wait list. But the reality is workforce remains a challenge. Who wants to do work that's difficult when you can get paid a little bit more and not have the difficulty associated with treating somebody with mental health challenges? Folks are in many cases going to grad school, taking out student loans and entering a field where they're going to consistently be paid less than other professions. And I think that's tough. And so that's not unlike other, fields that have, struggle in that area. Like teachers are another example where they're doing critical work but might consistently be underpaid. But I would say, the state and the federal government really have to prioritize how do we shift from workforce crisis mode to meeting the need for mental health services. If we are able to focus on prevention, if we're able to focus on treating people that need help now, it's going to save our state and our country money later for more expensive means of treating those individuals that might choose a much darker path, whether we're talking hospitalization or cycling through the criminal justice system. So it's important that and we're having these conversations at the state level with this legislative session, is how do we incentivize folks to create really a pipeline for those to go into this field? So really helping, students, for instance, dealing with unpaid internships, right? A lot of internship placements when you're going into this field can be a challenge when you're trying to juggle like a part-time job, trying to juggle the internship hours and trying to study for school. So how do we incentivize folks to handle that situation? How do we incentivize folks to stay in the workforce? I think there's so many different things with that, but workforce is one of the big challenges.
Well, workforce and financial struggles are,
Yes.
Two big factors in deteriorating mental health. And how would you react to that?
Absolutely. I think there's a lot coming at folks at any given time. We absolutely see, when folks are struggling financially, if they're constantly concerned about providing their basic level of needs, that really nothing else matters at that point. They're just focusing on keeping a roof over their head if they have that, keeping their job if they have one, and keeping food on the table. And when that's your primary focus and you're constantly having to be under stress and strain from a financial sense, that absolutely can deteriorate your mental health. And so it's even more important than in those circumstances to reach out more frequently for support. And support for one person may look like a different type of support to another person. In some cases, it might be reaching out to a friend that you haven't spoken to in a while or a family member, but in some cases, it's talking to a professional. And that's why I think, leaning on things like our free peer support line, that's 24/7. It's not necessarily the crisis line, but if you're really just trying to process your feelings and you need to lean on somebody, I'm a big believer in that. So the peer support line is really important. So I absolutely think that. And any struggle that you're going through, whether it could be a big life challenge or a big life change, we see folks when they like lose their job, for instance, that's such a sizable hit to your whole persona in many cases. Our identities in many cases are wrapped up in job titles and jobs, right? And so it can be a huge hit to your mental health to figure out how do you process next steps. And so that's why, as we normalize the conversation and reduce the stigma attached to seeking mental health, part of that is like in those moments, know that you can reach out for assistance, you can reach out for help. And even though there are wait lists for services, Patrick, I think it's important to note that there are openings for services. What we see with our Hope and Healing Centers is because of the structure of those programs, you can still walk in off the street and get help. With our peer support line, it's 24/7 and it's free. Talk to somebody on that. So as at a bare minimum, you have something to rely on. Our mobile crisis services through 988, they're there. So there's openings for, crisis stabilization units. So if you really just need to be out of your physical environment because of a deteriorating mental health and you're going through a mental health challenge, particularly in a crisis situation, we have openings in our crisis stabilization units, our residential units. For youth, we have openings in our special purpose K through 12 school. If you're struggling in the typical school environment and you might be on an IEP or like a special education plan, basically, there's no cost to the family to basically have their school send their student to our campus in Saco, where they will graduate with a degree from their sending school. So it's not like a separate degree from Sweetser, it's a degree from their sending school. And we have students from all over the area, anywhere from Kittery to Lewiston South, basically. And what we find is, they just need a mixture of both day treatment for their mental health challenges along with their educational experiences and journeys.
I think from an early age, I was drawn to coaching youth. It started with my passion for athletics, so that's where it kind of took off. As I got older, I just started realizing how much I enjoyed working with young people. I feel like they want the help and they just don't always say it or aren't always able to let people know that they want help and they want guidance. And once I started with Sweetser, I initially started in the crisis unit here on campus and didn't know what I was getting to at first, but the more and more I worked with them every day, the more I realized I think this was my path. It worked out for me better to switch over to the school, and just having the consistency with kids every day and being there for them, knowing that outside of this setting might be a little more rough for them. It's something that I want to help as much as I can. The consistency I can give now as a teacher to be able to know that they have someone they can go to every day and they're going to get the same thing, whether I have a good day or a bad day, or they're having a good day or a bad day. I'm going to give them the same thing every single day, and they can count on me to be there with the same responses, same actions, and same everything. I really do believe in the work that we do here for these kids, and I think that a special part about the staff here, and I could speak more so for the school aspect, is everyone is here for the right reason, and everyone is here because they genuinely care about helping these kids make their lives better.
One of the things that I really find is so special about our school is we have actually infused trade learning as part of the curriculum. So they're able to go into the woodshop program. They're able to literally work on our farm and work with animals. So they're learning things like empathy, right? They're tapping trees, boiling the sap, and creating and bottling maple syrup right on campus. When they're creating something, whether in the wood shop or, with maple syrup, or they're fixing a car in our automotive program, the kids light up. They see the tangible thing that they're able to create or do or work on. And not every kid is going to flourish in a classroom environment, and that's okay. But part of their healing journey, part of their therapy, is to have those hands-on experiences. And what we see is when kids graduate and they come back and tell us, where they're at in their lives, we hear from former students that have become small business owners. They've been successful in lives. They're married. They have kids of their own. They're volunteering in the community. They've become productive members of society because of that support, because someone cared enough to say, you know what, I do need a little bit of a different path here. And I do need some more support. And maybe in the moment, they're not thinking that as the young person, but their families took action and did something. Their school environment did something and said, you know what, this needs to be for you. And because of that, we see so many success stories because of it.
Given the horrible mass shooting that took place in Lewiston, after that event, do you find yourself working more with law enforcement, or was there already an effort underway to do so?
I think there was already an effort to do so, but I think that really heightened the need to co-respond to situations. And I think the legislature and other entities have really focused in on how can we do that. So we've co-responded through a number of different initiatives. So one would be like our substance use services. It's called Know Your Options. So knowyouroptions.me to find your local options liaison. But essentially these individuals help connect you to important treatment options in your area. This program has been so successful that we're one of many reasons that we're seeing a reduction in overdose deaths across the state, finally, which is such a huge issue for a lot of different communities. And so the expansion of the Options program, where we have these liaisons built into counties across the state, has been instrumental in just connecting people to the help that they need. We also have 6 recovery coaches across the state. These are individuals that oftentimes have lived experience with their own substance use challenges and are able to really have authentic connection with folks that are struggling, and again, connecting them to resources, treatment options, based on their own individual needs. Sometimes it's not always a one-size-fits-all solution to folks, and everyone's journey looks a little bit different, and it's important for folks to have somebody that's there to listen to that, acknowledge their experience of where they've come from up until this point, and then really work with them to tailor some things that's ultimately going to lead to success for them and a recovery journey that's going to be tailored to their lives.
We did mention in this interview that the stigma over mental health has lessened, but it's still there. What would you say to someone who was hesitating to call Sweetser or another organization?
I would say, hope and help is available. Hope and help are available to you when you need it. It may not be today, but maybe tomorrow is that day when you decide that I do need to speak to somebody that either has lived experience or can just professionally be there for you. I think it's important to start small. So if you really don't know where to turn to, or you feel like you really don't want to make that call, maybe you start with an email. Email us at info@sweetser.org and you say, I don't really know what I need to do yet. What would be step one? Maybe it's text. Maybe you can text the 988 number and just say, this is where I'm at. I find that having multiple methods of communication may seem like a simple thing, but it matters because in the past there's only been phone numbers to call. The fact that individuals could walk into one of our centers to be connected to folks, but that can feel, even in and of itself, could feel like a barrier. I do find, like, if I was to pinpoint one thing, talking to one of our peers on our peer support line, and I know I've mentioned this several times, but it is one of those resources that if you didn't know it existed, it's such a wonderful resource. And you don't have to give your name. You don't have to give any insurance information. There's none of that involved. So it is anonymous. And so for a lot of folks, that's important to know, right? They don't feel, it's not intrusive in that way. You call when you need it, and then once that exchange ends, that's the end of that dynamic. That's the end of that relationship. So there's no accountability after that. There's no ongoing relationship. And some folks just need that one-off. And that might give that individual who's trying to like process how best to engage with the behavioral health system, or kind of, I may not feel super comfortable, the confidence to say, okay, let me take it to the next step. Maybe I do need to talk to somebody where I can develop more of an ongoing relationship with, like a general therapy session with one of our independent affiliates. So I think that that's a great entry point into accessing the system. And again, coming back to the fact that one of the barriers is not knowing where to start and not knowing what you need for help. I don't come from a clinical background. So for me, as I talk about a lot of these subject matters, it's been an eye-opening experience to see what else is out there. But there's so many programs and there's so many acronyms. It could give me anxiety just trying to think about all the different programs that we have. And so I can only imagine for somebody struggling where it's like, I don't know what I need. I don't know if it's this one, that, or the other. I just know I need something. I need help. And that's when I think just reaching out and making that first step is so important.
Do you find that there's a spike in calls seasonally? I mean, of course, we have something called SAD, seasonal affectational disorder. Is winter a big time for you, or is it just spread out throughout the seasons as far as mental health referrals?
Absolutely. Winter's particularly challenging for a lot of folks in Maine because transportation issues, mobility issues for our aging population. Who wants to drive in the ice and the snow that we've had recently? And so I think any of the changing of the seasons, we do notice there's shifts in mindset, there's shifts in challenges. It also can be triggering depending on what you've experienced in your life. So for instance, holidays, for instance, can be a triggering event. If you had a death in the family around that time, what we find consistently is people are trying to then grapple with the emotions associated with, honoring and recognizing that family member, grieving, but then also that quote unquote happiness of the time of how do I keep moving forward? How do I continue to have more positive experiences with family members while also honoring and grieving for the family member? That can be a challenge just to process that. So I would say the typical, what we as a society like to think of as a joyous time, could be around holidays, it could be around special occasions, can also be like the worst possible thing and day for folks that are struggling with their mental health, depending on their past traumas or experiences. So I think it's always important to preface that because, whether we're talking Valentine's Day and the fact that while there might be folks that have a partner or have a significant other in their life, there's going to be folks that are on the opposite end of that spectrum that feel completely isolated and alone and sad around those feelings. So we do see that when you're around a particular day of recognition, a particular month, a particular season, it can really be triggering depending on your past experiences. So around wintertime, absolutely, it can heighten feelings of isolation because if you're not willing or able to go outside, in the winter and venture out, you're going to be disconnected from feelings, a sense of community, a sense of togetherness. And so that's why I come back to, if you're feeling alone and isolated, whether it's this time or another time, maybe you use, the internet or other methods to try to find that connection or cultivate that connection. We keep seeing on the news, random people coming together in coffee shops to say, okay, maybe it's a 50 plus club, maybe it's getting together and playing a card game, just something where you're able to connect with folks and meet people, because I think we're really going down a path where there's less and less organic opportunities to meet people. I feel like whether we're talking online or otherwise, more and more I feel like we're just being at home, homebodies, and to some extent that might be because of your own challenges in your life or just the nature of living in a more rural state. So I think we have to be intentional about trying to seek out opportunities for connection, while in other places or more urban environments, you may not have to do that.
I do see evidence of that taking place here, most specifically in Buxton. The Aging in Buxton organization distributes food boxes to the elderly.
Yeah, so important.
Yes.
Yeah, and they do incredible work. We just recognize them at the county level with a Spirit of America award. Groups like that are important. So for folks that want to volunteer, I know they're always looking for volunteers for that aging group. In the service of helping others, you're going to be helping yourself. So I think you can help out with that group, but even just that group making that connection, delivering a food box to someone. I mean, how powerful is that to see somebody who might be struggling with either food insecurity, which is a huge issue within our state of Maine, but as well as just maybe it's the first time they've actually interacted with somebody all week was that one delivery of that food box. So you never know what people are going through. You never know the struggle that people are going through. They might put on a smile. They may not, but they might put on a smile, and there might be more to it than that. So I think it's important to check in on people. Maybe there's a friend that you haven't spoken to in a while, and they live long distance. We all get busy, the daily hustle and bustle, but pick up that phone, shoot a text message. Hey, I'm thinking about you. I think the more we can be intentional about recognizing the folks that we appreciate in our lives, whether it be a former colleague or a coworker or a friend, a family member, it's just important that right now more than ever that we feel more connected.
Yes, absolutely.
Yeah.
Listen, I think that Sweetser made a wise choice when they hired you, because
Well,
I've observed you for many years as a political person, and I think you genuinely care about people, and you have been a model citizen in many ways, and we're honored to have you here at the station.
Well, thank you, Patrick, and thank you for all what you're doing here at the station. It's so important.
Sweetser is a nonprofit community mental health provider offering quality treatment, support, and hope for people of all ages. Services include mental and behavioral health, intellectual and developmental disabilities, recovery, and education. Our staff, volunteers, and donors help create promising futures for those we serve. As the largest mobile crisis provider in the state covering more than half of Maine's 16 counties, Sweetser wants people to know that support is available. Learn more at sweetser.org.